Thanks for joining us today. I'm Preksha, founder of Freemium, and today I'm excited to talk to you about necessary, important documents and considerations when applying for health insurance. So, as an insurance agreement is a complicated contract between the insurer and the insured, insurance companies seek to know their customer and ask for a range of documentations before they commit to receive premiums and disperse claims. Following will be a short overview of the kind of documentation required at each stage of the insurance process. So, the required documents for applying for health insurance usually include age proof. You could show this through a voter ID or the Aadhaar card. Photographs. Passport size clear photographs are asked for. Identity proof. One document out of the passport, Aadhaar card, or the driving license can be shown. Medical report. Some insurers might even ask for these, but they're not mandatory. Address proof. So a ration card, driving license, or a rent agreement can be presented. Proposal form. All insurers will ask for some kind of proposal form to be filled out to compile the data of the person sought to be insured. A different set of documents are required while making claims. The following are a duty filled claim form, medical certificate, patient's discharge summary or the card in the original, prescription and cash invoice from pharmacies or the hospital, investigation reports, FIR or medical legal certificate in the event of an accident. Now, coming on to the aspects to consider. There are many aspects to consider while deciding which insurance to buy. It is important to find the right kind of insurance that covers our needs and is financially possible for us at the same time. So some examples of the reasoning one can undertake before deciding on the insurance are the insured sum. It is important to check whether the sum that the company is ready to pay finally would cover up all our needs at the time of a health emergency. If we end up paying 50% of our expenses out of our pocket, despite having us paying premiums for many years, then the policy would just be a waste of money. Waiting period. This is the time that the insured must wait before their coverage comes into effect. This is especially crucial when the hospital is asking for the full payment of the bill before discharge, and we might not be able to arrange a temporary loan to pay for the expenses while the coverage comes into force. Thirdly, network of hospitals. It is important to consider the number of hospitals the company is tied to and is willing to accept in the insurance form. At the time of being unwell, we might not always be able to reach out to the same group of limited hospitals covered under the insurance, which is exactly why it would make sense to choose a policy that includes a broad network of hospitals. Some important exclusions are: it is important not to buy an overly restrictive policy that excludes coverage for certain elements. It is not possible to know in advance exactly what the damage or the cost of the treatment is likely to be. So it is wise to buy a policy with relatively fewer exceptions. Of course, insurance companies also cannot run the risk of being liable to pay for everything, which is why exemptions were created. But at the same time, it is essential to ensure that our needs are being met. That's all for today. Thank you for listening. See you next time.